Carol was 68. She was sipping her morning coffee like every other day. The sun was coming in through the window, and her husband had just sat down to read the paper. Then something changed. Suddenly, Carol felt a strange numbness on one side of her face. When she tried to speak, the words didn't come out right. It was as if her mouth wasn't keeping up with her mind. Her husband looked at her and remembered a video they had watched just a few weeks earlier. A video that said, "Time is brain." He didn't wait. He didn't ask questions. He grabbed his keys and drove her straight to the ER. Carol was having a stroke. Because he acted fast, the doctors were able to reverse the damage. Her speech returned. Her face relaxed. And most importantly, her brain was saved. Now let me ask you something. If that had been you, or your partner, or your best friend, would you have recognized the signs in time? Every year, hundreds of thousands of Americans over the age of 60 suffer strokes. And many don't make it, simply because no one realized what was happening until it was too late. That's why you're here. Because today, I'm going to show you exactly how to recognize the early signs of stroke. Not in a medical textbook way, but in a way that sticks with you, so that when the moment comes, and I hope it never does, you'll know what to do. Because instead of freezing or hoping it goes away, you'll act. And that decision could save a life, maybe even your own. Let me tell you 3 more stories. Real people, real lives changed in moments. Jessica was 32. Just 4 days after giving birth, she was cradling her newborn when a wave of dizziness hit. She tried to stand, but her legs felt like jelly. Her words came out slurred. Her husband didn't hesitate. He rushed her to the hospital. Within minutes, doctors gave her clot-busting medication through an IV. Her speech returned. Her legs regained strength. The dizziness vanished. She was lucky. Very lucky. Now let's talk about Hugo. He was 62, a lawyer who had built his life around long hours and late nights. He had high blood pressure, diabetes, and was overweight, but he didn't take it seriously. One night at 2 a.m., sitting at his desk, he felt a thunderous headache, the worst of his life. He called his sister, a nurse. Then he collapsed. 10 days later, he woke up in the ICU. He had gone through emergency brain surgery and was in a medically induced coma. The stroke had been massive. Then there's Regina. She was 58. She had heart rhythm problems, arrhythmias, but hadn't seen a doctor in years. One evening at a family gathering, her daughter noticed her mother's mouth looked strange, drooping. Regina saw it in the mirror too. On the way to the hospital, the symptoms seemed to fade, but the MRI told a different story. She had experienced a small stroke, a warning shot. Now, listen to this comment from a viewer named Carol. She wrote, "I was just sipping coffee when my mouth went limp. My husband recognized the signs from a video. He rushed me to the ER. The doctors said, if he had waited even 15 minutes more, the outcome would have been very different." These stories, Jessica, Hugo, Regina, and Carol, they are all different. But they share one thing. They had strokes, and their outcomes depended entirely on one thing: how fast someone recognized what was happening. Instead of wondering, instead of watching and waiting, someone acted. That's the difference. That's the message. Because when it comes to stroke, time is brain. And recognizing the signs early, even the subtle ones, can mean the difference between full recovery and lifelong disability. So what exactly is a stroke? At its core, a stroke happens when blood flow to a part of your brain suddenly stops. And without blood, that part of your brain, whether it controls speech, memory, vision, or balance, starts dying. Not slowly, but fast. Every minute, about 2 million brain cells die. Let me say that again. Every minute, your brain loses 2 million cells. That's why we say, time is brain. You see, your heart pumps life to your brain with every beat. But when something blocks that blood, like a clot, or when a vessel bursts, that life is cut off. It's like watching memories leak from a broken dam. Skills you've held for decades, walking, talking, smiling, can vanish in seconds. 20 years ago, we didn't have much to offer. You'd go to the ER, get a scan, maybe take aspirin, and then we'd wait. But not anymore. Today, we have medications that can dissolve clots. We have procedures that can physically pull the blockage out, restoring blood to the brain. I've seen patients come in unable to speak, unable to move. Then, minutes after treatment, they blink. They whisper their name. They squeeze a hand. And sometimes, they cry. Because they realize they're coming back. But here's the thing. Those miracles only happen when you act fast. Think about it this way. Instead of waiting to see if the arm stops feeling numb, or if the words will get clearer, what if we moved right away? What if we treated every strange symptom like an emergency? Because it is. Every second lost is brain tissue gone. And in those early moments, you have more power than the ER doctor. You're the one who decides how soon help arrives. Time is brain. And brain is everything. Now, let's talk about how you can recognize a stroke fast. Because every minute matters, you need something simple. Something you can remember when the pressure is on. It's called Be Fast. Each letter stands for a symptom you need to watch for. And together, they could help you save a life. B is for balance. Has the person suddenly lost their balance? Are they stumbling? Do they seem unsteady for no reason? E is for eyes. Are they having trouble seeing out of one or both eyes? Is their vision suddenly blurred or double? F is for face. Ask them to smile. Does one side of the face droop? Is the smile uneven? A is for arms. Ask them to raise both arms. Does one arm drift downward or feel weak or numb? S is for speech. Ask them to say a simple sentence. Is their speech slurred? Are the words jumbled or hard to understand? T is for time. And that might be the most important one, because if you see even one of these signs, it's time to call 911 immediately. Don't second-guess it. Don't wait to see if it goes away. A stroke isn't like a pulled muscle or a little dizziness from standing up too fast. Instead of hoping it's nothing, assume it's something, and act. Because in many cases, the difference between full recovery and permanent disability is just 10 minutes. One viewer left a comment that stuck with me. She wrote, "I thought I was speaking clearly, but my family said it sounded like I was drunk. I was smiling, but my smile was crooked. I had no idea." That's why Be Fast is so powerful. You don't have to be a doctor. You just have to remember 6 letters. And when you do, you might just save someone's ability to speak, walk, or even live. So say it with me. Be fast. Balance. Eyes, face, arms, speech, time. Remember it. Share it. Teach it to someone you love. Now here's a question that hits close to home for many. What if you're alone when a stroke happens? You see, most people assume someone else will be there, will notice, will call 911, will act. But what if there's no one in the room? No family around? No one to say, "Your smile looks off," or Your speech sounds strange. That's the reality for millions of older adults, living independently, proudly, but also vulnerably. One viewer wrote, "I live alone. When the stroke hit, I knew something was wrong, but I couldn't move, I couldn't speak, and I couldn't get to the phone. That's why planning ahead matters, not when it's already happening. But now, so let's talk solutions. There are medical alert systems designed specifically for situations like this. Small wearable buttons, neck pendants, wristbands, devices that detect falls or sudden changes in movement, and can call for help automatically. Some even have voice activation. Others connect directly to family members or emergency dispatch. It's not about being dramatic. It's about being prepared. Because instead of lying helpless on the floor, wondering if someone will check on you, imagine having a system that does the calling for you. Instead of minutes slipping by, you're getting help. Fast. And remember, time is brain. If you live alone, or if your spouse or parent does, this isn't optional. It's brain insurance. It's peace of mind. And no, it's not just for people over 80. Strokes are hitting younger and younger. We've heard from people in their 30s and 40s who had no idea they were at risk. So, let me ask, do you have a plan? If a stroke happened tonight, while you're sleeping, would help be on the way? Because the scariest thing isn't the stroke itself. It's not being able to reach help when it counts most. Let's clear up one of the most dangerous misunderstandings about stroke. Some people believe that when a stroke strikes, the first thing they should do is take an aspirin. Maybe they heard it from a friend. Maybe they read it online. But here's the truth. That advice could be deadly. Yes, aspirin helps thin the blood. And yes, it's used in some emergencies like heart attacks. But stroke? That's different. There are two main types of stroke. One caused by a clot, and one caused by bleeding. We'll get into the details in a moment, but for now, understand this. If you take aspirin during a bleeding stroke, it can make things far worse. It's like trying to put out a fire by throwing gasoline on it. The only way to know which kind of stroke someone is having is through a brain scan, usually a CT. And until doctors can see what's going on inside your head, aspirin should not be part of the plan. One study showed that nearly 15% of strokes are hemorrhagic, bleeding strokes. That's not a small number. So, if you're reaching for aspirin during a sudden headache, slurred speech, or arm weakness, stop. Call 911 instead. Let the doctors decide. That's what they're trained for. Now, you might ask, but I take aspirin every day to prevent strokes. Isn't that safe? And the answer is, not for everyone. In fact, new guidelines say that adults over 60 who haven't had a heart attack or stroke should not start taking daily aspirin without medical supervision. The bleeding risks, especially in the stomach and brain, may outweigh the benefits. So, instead of guessing, why not have a real conversation with your doctor? Because instead of relying on myths, let's rely on facts. Instead of trying to treat a stroke yourself, let the ER do what it's built for. And always remember, fast action saves lives. Aspirin, if taken at the wrong time, could do the opposite. Not all strokes are the same. To truly understand what's happening, and why some symptoms seem to come and go while others leave lasting damage, we need to look at the three main types of stroke. Let's start with the most common, ischemic stroke. This type accounts for nearly 85% of all strokes. It happens when a blood clot blocks an artery that carries oxygen-rich blood to the brain. The clot can form locally, or it can travel from the heart or neck and lodge in a smaller vessel. Think of it like a clogged pipe in your house. Water can't reach where it's needed. The longer the clog sits, the more damage it causes. Then there's the second type, hemorrhagic stroke. This is caused by a burst blood vessel inside the brain. When that vessel ruptures, it spills blood into brain tissue, causing pressure, swelling, and massive damage. One common cause? An aneurysm, a weak spot in the vessel wall that balloons out over time. Like a tire with a soft bubble, it holds until it bursts. This kind of stroke is more deadly, and it's why taking aspirin, as we talked about earlier, can be dangerous. If you're bleeding inside the brain, the last thing you want is thinner blood. Finally, there's something called a TIA, a transient ischemic attack. Some people call it a mini-stroke. But don't let the name fool you. A TIA is not small. It's a massive warning sign. It happens when a clot blocks blood flow for just a few minutes, then clears on its own. Symptoms come and go quickly, sometimes in under an hour, and many people ignore them. But here's the truth. 1 in 3 people who have a TIA will go on to have a full stroke, often within a year. So instead of thinking, well, I feel better now, think of it as your brain giving you a second chance, a spark before the fire. If you or someone you know has ever had symptoms that vanished fast, numbness, slurred speech, blurred vision, don't shrug it off. Don't wait. Because when it comes to stroke, the type may vary, but the urgency never does. So now we know what a stroke is. We know how fast it can happen. But what causes it in the first place? Let's start with the biggest culprit of them all: high blood pressure. It's the #1 risk factor, the silent threat. Many people have no idea they even have it. But day after day, high pressure wears down the walls of your arteries, making them stiff, narrow, and prone to clots or bursts. So if you've been told your pressure is high, even just a little, take it seriously. Because instead of ignoring it, you can control it. You can protect your brain. Now let's add to the list: smoking, diabetes, high cholesterol, atrial fibrillation, lack of exercise, obesity, family history. These are all major risk factors, and the more of them you have, the higher your risk climbs. But here's something you might not expect. Strokes are no longer just happening to older men with a lifetime of bad habits. We're seeing more strokes in younger adults, even people in their 30s, even women in their 20s and 30s, especially after childbirth. One viewer wrote, "I had a stroke 3 months after giving birth. The doctors said it was from the pressure I put on my body while pushing. And no one warned me this could happen." Another case, a 42-year-old woman on birth control with migraines and high blood pressure. She collapsed at work. A massive stroke. No warning. This is why your risk isn't just about age. It's about your habits, your numbers, and sometimes your biology. If you're living with AFib, an irregular heartbeat, your risk of stroke is 5 times higher. That's not a small bump. That's a flashing red warning sign. And if you've been told you have borderline diabetes or just a little cholesterol, don't let those words fool you. Your brain doesn't care if it's borderline. A clot is a clot. So let me ask you, when was the last time you checked your blood pressure? Your sugar? Your cholesterol? Because instead of finding out after the stroke, you can know now. You can act now. And acting now means giving your brain the best chance to stay sharp, steady, and strong. Let's talk about what you can do, starting today, to lower your stroke risk. Because yes, stroke is fast, but prevention is slow and steady. And that's a good thing. You don't need to change your life overnight, but you do need to start somewhere. And the truth is, you have more power than you think. Let's begin with the basics. Keep your blood pressure under control. This means checking it regularly, at home or at the pharmacy, and taking your medication exactly as prescribed. Not just when you feel off. Quit smoking. I know it's hard. I've seen it up close. But I've also seen patients who quit at 65 and lived strong into their 90s. Instead of lighting up, try walking around the block. One habit replaces another. Manage your blood sugar. If you have diabetes, stay on top of your numbers. Watch your A1C, follow your meal plan, and move your body. Even a 20-minute walk after dinner can help. Eat foods that love your arteries. More fruits, more vegetables, whole grains, less salt, less processed fat. Think of food not just as fuel, but as medicine for your brain. Get moving, gently and regularly. You don't need to run a marathon. Just walk, stretch, dance a little in the kitchen. Instead of sitting for hours, stand up every 30 minutes. Your circulation will thank you. Watch your weight, not for appearance, but because every extra pound adds pressure to your heart and blood vessels. Losing even 5 or 10 pounds can make a real difference. Control your cholesterol. Get it checked. Follow your doctor's plan. Remember those little numbers on a lab report? They translate to big results in real life. And lastly, don't skip your checkups. That appointment you've been putting off? That's your early warning system. Instead of waiting for symptoms, you get ahead of the damage. Here's what I've learned after decades as a cardiologist. It's not about being perfect. It's about being consistent. Because every small step you take today is a step away from the ER. A step toward staying independent, staying sharp, staying you. And that's worth it. Every time. If you've made it this far, I want to thank you. Not just for watching, but for caring. For taking the time to learn something that could truly change a life. Maybe yours. Maybe someone you love. Because the truth is, stroke doesn't wait. It doesn't knock first. It doesn't care if you're on vacation or watching your grandkids or just making toast on a quiet morning. But now, you're ready. You know the signs. You know what to do. Instead of freezing, you'll move. Instead of guessing, you'll call. That's powerful. So here's my challenge to you. Share this video. Send it to your spouse, your adult children, your church group, your neighbors, anyone over 50, anyone living alone, anyone who needs to know. Because the more people who understand what we've talked about today, the more lives we protect. And if you're ready to go one step deeper, don't stop here. Watch our full video on hypertension. Because that's the #1 stroke risk factor. Watch our breakdown on diabetes. Because it's the silent engine behind so many strokes. And don't miss our deep dive into atrial fibrillation. Because those flutters in your chest could be the warning sign you never knew to take seriously. You'll find all those videos right here on the channel. They're clear, practical, no scare tactics, just truth you can use. My name is Dr. Bill. This is Golden Wellness 365, and I'll see you next time.